Welcome to the show you've been waiting for. Celebrate Live. This is the 109 edition, also called Unity Against Ebola. Mr. Chavez, Mr. Anselm, Mr. Olette, thank you for sharing the podium with me. Today's celebration has been cancelled more than 4 times. Most people tell me, Pierre, this issue is too much emotional. Let the CDC handle it. I try, but I'm not comfortable until today Mr. Olette make this call a reality. Mr. Olette, thank you for making that happen. Ebola has been around, according to the history, 1976. Mr. Olette earlier said that you don't think that we try hard enough in terms of finding a cure. But we understand that it is important, and most people I talk to, they think that if you don't find a cure for Ebola, it might be the topic, the issue for this generation. Across the country, around the world, we hear call for travel ban. We should call also about appointing a czar. We hear call also about a government do not do enough. But today's celebration, let's make this celebration an occasion to show solidarity not only to West Africa, to America, but they are on the world. Before we go forward in that celebration, let's ask our pastor, who is in Canada, to lead us in an opening prayer. Pastor, please lead us in a prayer.
Inclinons-nous pour la prière. Seigneur, nous te prions pour mes bien-aimés qui sont là et ceux qui t'écoutent. Faites ces œuvres dans chacune de nos vies, Père. Donnez-nous dans nos cœurs le désir de vérité qui est en toi. Agir profondément. Seigneur, nous te prions pour que ton nom soit glorifié, pour que ta volonté se fasse comme tu le veux, pour ceux qui sont autour de nous puissent être attirés par la réalité qui est en nous. Seigneur, par quelque chose de vrai, d'authentique qui vient de toi, nous te demandons comme une grâce de tout mon cœur, que ta vérité règne au milieu de nous par un amour sans hypocrisie. Et nous te demandons de bénir ce moment que nous allons passer ensemble, de tout diriger, de prendre tout en main pour que ton nom soit glorifié. Aussi, Pierre, nous te demandons de bénir l'émission Celebrate Live. Permets que cette émission soit un témoin véritable dans ce moment qui se perd. Au nom de Jésus, nous te prions. Amen.
Amen. Thank you, Pastor Arthur. Thank you, Mr. Olette, for making that happen today, this gathering. Thank you, Mr. Chavis. Thank you, Mr. Anselm. Thank you also to Manchester Public Television, who allow us to be here on this very important historic day. As I said in my introduction, most people I talked to, they said that Ebola could be the challenge of our generation. So let's ask our operator whenever he's ready to play this wonderful video that it is a courtesy of Olette at large. Whenever he's ready.
Ebola virus disease, formerly known as Ebola hemorrhagic fever, is described by the World Health Organization, WHO, as a severe, often fatal illness in humans. It first appeared in 1976 in 2 simultaneous outbreaks, in Nizara, Sudan, and in Iambuku, in the Democratic Republic of Congo. The latter was in a village situated near the Ebola River, from which the disease takes its name. It is mainly found in tropical Central and West Africa, and can have a 90% mortality rate, although it is now at about 60%. The virus is known to live in fruit bats, and normally affects people living in or near tropical rainforests. It is introduced into the human population through close contact with the sweat, blood, secretions, organs or other bodily fluids of infected animals such as chimpanzees, gorillas, fruit bats, monkeys, forest antelope and porcupines found ill or dead or in the rainforest. The virus then spreads in the community through human-to-human transmission, with infection resulting from direct contact, through broken skin or mucous membranes, and indirect contact with environments contaminated with such fluids. The World Health Organization says the disease is not contagious until a person begins to show symptoms. A big problem in West Africa is that burial ceremonies, in which mourners have direct contact with the body of the deceased person, can increase the spread of the disease because a person can transmit the virus even after death. Men who have recovered from the disease can still transmit the virus through their semen for up to 7 weeks after recovery from illness. Symptoms begin with fever, muscle pain and a sore throat, then rapidly escalate to vomiting, diarrhea and internal and external bleeding. The incubation period, that is, the time interval from infection with the virus to onset of symptoms, is from 2 to 21 days. Health workers are at serious risk of contracting the disease. 2 American doctors have already contracted it, and a Liberian medic has died. Sierra Leone announced on July 23 Sheikh Umar Khan, the doctor leading the fight against Ebola in the country, had himself contracted the disease following the deaths of several nurses at the treatment center where he works. Early treatment improves a patient's chances of survival. There is no vaccine or cure, and testing to confirm the virus must be done with the highest level of biohazard protection. Severely ill patients require intensive supportive. Patients are frequently dehydrated and require oral rehydration with solutions containing electrolytes or intravenous fluids. A significant problem with the current outbreak is families lose faith in Western medicine, which cannot yet cure the patients. They then take them home to traditional village healers, which often leads the disease to spread. The WHO is calling this the largest outbreak ever recorded of the disease. But there have been sporadic outbreaks before, mainly in Uganda, the Democratic Republic of Congo, Sudan and Gabon. The worst previous outbreak, in 2000 in Uganda, saw 425 people infected, of which just over half died.
Comment est-ce que c'est? Qu'est-ce que c'est?
6 weeks ago, Alhaji Abba died here, alone and sick with Ebola.
He refused to get into the treatment center. He was afraid of the ambulance.
His room remained untouched. Photos of his family remained on the walls. His sandals still lay by the bed.
We met him sitting at the bed, bowing his head like this on the bed. We took him to the cemetery for burial.
This is Ben C. Solomon for the New York Times. Deep in the thick forests of eastern Sierra Leone lies the village of Njalagima. Here, in the most Ebola-afflicted district of Kailaun, this is the hardest hit village.
61 people die in this town. Everybody is affected now.
Nearly 1 in 10 people were killed in the span of a few months. Across West Africa, Almost 1,000 people have now died in what has become the worst Ebola outbreak in history. In this small farming community, the scars are all too clear.
One husband, his wife, and a child died. They were sleeping in the same bed.
The homes of the dead remain frozen in time.
Here are 5. They all die here. The whole family, 5 of them. The person who died in this house is the treasure. We are afraid for touch it.
All the rooms were disinfected by local volunteers. Most villagers refused to go near them. Across Sierra Leone, aid agencies are struggling to keep up.
In an Ebola outbreak, what is the most important, what we always say, you have to be a step further. But here, not even 1 step. I think we are 2 steps behind. We are working here since 8 weeks, 9 weeks to do health promotion and everything. And still it's like...
Military troops have set up checkpoints all over the region
36.6
to stop the spread of the disease. For now, the situation in Njala has stabilized.
Everybody is strong now. It has been 25 days. We don't have no patient here.
But for villagers, the damage has already been done.
They are orphaned. 15 of them. They are living with their grandfather. So if we think about the kind of people they have died, it's very difficult to forget.
Thank you very much. Job well done. Before we go ahead with our one-on-one question with our friend from Benin, West Africa, let's ask our pastor a quick question. One, yes or no? Pastor, y a-t-il cases of Ebola in Canada?
Until now, we don't have any Ebola case in Canada.
All right,
yesterday, I was talking to my friend. She's a doctor. She named Michelle Surprise. I was talking to her about Ebola case in Canada. She told me they don't have any case, but they receive a lot of email from different hospitals about the issue. So they work so hard. There are only some cases, like some fever, some people have a cough, people have a, but for Ebola case, not now. But so they are ready. Before the show, I was watching TV about a minister, secretary, health minister in Canada, take a lot of precaution for the Ebola case. So a different border, Canadian border, all those stuff, or even at the Canadian airport, international airport in Canada, different area. So they are ready for that case.
All right, thank you very much. Canada is mobilizing for that too against Ebola. Mr. Wallet, whenever you're ready, you can start your first question.
My first question, sir, is that in West Africa, for you to leave Nashua, you live in Nashua.
Yeah, I live in Nashua.
What airport do you take to go home?
I will go from Boston to France and then to Benin.
So there is no direct flight from Benin
No.
to the United States?
No.
As there's no direct flight to Guinea, Sierra Leone, and what's the other one?
No. Sierra Leone, Guinea, Liberia.
Liberia.
Yeah.
So if we close those 3 airports from coming here, they don't come here anyway. They have to go through Belgium, France, or England.
Yeah.
So what we're really saying here, or the Republicans are really saying here, is we should close all our airlines. I still maintain that if we have them come as they are now, we, take their temperature when they get here, we ask them questions, we have a better control over it, where if we control the airlines, they'll get here anyway, and we won't know how they got here. Doesn't that make a lot more sense?
Yeah, that makes sense.
Now, can I comment on that? Now, I know that they're trying to do that and everything, but look at the gentleman that died in Texas. He came by airline, and he was asked those same questions. Now the problem is he lied on the.
Wait, stop right there. When he was interviewed at the hospital, first of all, at the hospital, he told them he had just come in from Liberia, and he told them that he had a temperature, and they agreed he did, and they sent him home with medicine. 3 days later, he came back, and he told them again. In fact, the nurse who interviewed him, the intake, put it in the computer, but the computer failed. So he didn't lie. He actually said where he came from.
I'm not talking about at the hospital. I'm talking about in Liberia before he left. They questioned them.
But they also took his temperature.
Right.
I know.
But
you know what? The point is...
The Liberian government's pressing charges.
That's fine. And they probably should if he lied. But the point is this here. Our government failed. And it's not necessarily the government. It's the hospital. The hospital in Texas failed tremendously. It may be a good hospital, but they didn't follow procedures. And that's why today you have 2 nurses that have it, because they didn't give them the gowns that they gave the same to the doctors. Everybody who is in contact with an Ebola patient must have the same protection. Don't you agree?
Yeah, I agree.
Oh, yeah. It has to be an isolated.
So we
medical.
need to take responsibility as hospitals, as an American government, and say, hey, if we're going to stop this, we need to at least follow the procedures that we create, and stop making it so political. For politicians to go on commercials to get elected and say, well, Jean Shaheen is in favor of this, and she voted for this. Excuse me? And it's gone too far. This is supposed to be about medicine, not politics. And remember, this czar would never have been appointed if the Congress last year would have done its job and voted in favor of the appointed Surgeon General. We don't even have a Surgeon General. So how can we expect to do our job? Congress needs to get off their butt and go back to work. They're on vacation right now. We have all these problems and they're on vacation.
I'm sorry, Congress shouldn't be, if you're an elected official like that, you don't have a vacation. That's how it should be.
Not 8 weeks and work 10 weeks and have 4 weeks off. Right. But I want to move on.
Thank you for your input. And Mr. Ansel, again, thank you for coming here today. And as you feel already that this conversation is getting very emotional and very educational too. I even heard that Mr. Wallet call you an expert in that area. Because you know that area. So even in terms of common sense. The West Africa, the ECOWAS community is a 16 country, and there is no there's border, but the open border, 16 country open border. Explain to New Hampshire, explain to the world how it's challenged to control the spread of disease from one country to another one.
It's gonna be very, very, very challenging, because in Africa, all those 16 countries, we move around. There's no border. Nobody control you. Go from here to here. Nobody stop you. So if you have the disease, even if America ban the flight, people just need to take their car, go to East Africa, take the flight from there, and they will bring the disease here. The main thing to do is to go over there and to help them to heal whoever is sick. That's all they have to do. But banning the flight is not going to solve the problem.
No, it's not.
Yeah.
We need to help them build the hospitals, the buildings and stuff like that. Bring in the medicine.
Bring the medicine. Try, do whatever they can do. Because there's nothing over there. There's no hospitals. There's nothing. Nothing. They don't have anything. So if you want to control the disease, you don't want... We say in Africa, when your neighbor's house is in fire, if you don't go help him, it's going to come to you sooner or later. So we have to contain the disease over there. Go over there, help them, build whatever they need to build to solve the problem.
And that's the whole point, and you're right. If we don't control it over there, you can close all the airlines you want. It's going to get here.
Sooner
or later.
Yeah.
So this disease is 40 years old. We've been at this for 40 years now.
I mean, if you look back many years ago, the AIDS outbreak.
Same thing.
It came from a third world country and it was brought here. They tried to contain it and failed horribly.
And I remember where Reagan waited till 4,000 Americans had died before they finally even mentioned the word HIV as a country. Let's not do that again. Let's do the right thing, solve the problem now before it gets to be spread here, as we're always seeing it now. But keep it under control.
As myself, and I know Pierre's a medical worker, I mean, there's protections that we take against stuff, but there's certain things that, I mean, if we're treating an Ebola patient, I'm sorry, I'm not going to treat them unless I'm fully protected. And same thing with blood. I don't do anything with blood without the proper protection.
I want you also to weigh on the West Africa response to that outbreak, and to weigh also on the America and maybe other foreign nation response. I heard America send about 3,000 up.
They'll have a total of 4, and they're going to be building the hospitals and teaching them how to protect themselves.
And isolation centers. I want to hear your point about that.
Yeah, it's a good thing. I wish they have done that at the beginning of that disease.
Yes.
Because it started with maybe one family. And then the family died. In Africa, at the funeral, everybody show up. And then they have to take care of the body. And then that's how the disease spread around. So if America have done that a long time ago, we won't be here even talking about that. But better...
Sooner than better.
Sooner than okay.
Better now than later.
Better than later. So I'm glad America is stepping out, sending people over there to help them out, and I wish all the rest of the big countries can do the same thing.
Actually, Canada is sending this month. They're sending a trial run on a vaccine. Now we have had that here, but we've used it all. Okay. Now we all know that there's not much money to be made in a brand new vaccine when it first comes out. And so the private sector won't do it but themselves. But our government have cut the funding for such vaccines. They need to put that money back in, because by saving their lives, we're saving our lives.
Yeah, exactly.
Now, according to the CDC, which I'm looking at their website right now, which is cdc.gov, and it says that the guidance for safe handling of human remains of Ebola patients. Only personnel that are trained with it should be the ones doing it. Handling human remain handling should be kept to a minimum, which I don't know if I'm the only one that thinks this, but who just walks up to a dead body and touches it? But autopsies are not allowed on Ebola patients unless it's deemed necessary, and it has to be a CDC official and a state health department official that perform the autopsy because of the risk, which is they are taking the correct steps, but they need to move a little bit faster.
All right, thank you very much. They have put us 4 minutes. I wish we have 1 hour so we can really explore that action. And we're ready to wrap up. We are going to emphasize now on our recommendation. And you take that America does the right thing. So in terms of prevention, contain what is there now, and then prevention. And I think also, Mr. Wallet, the world, America need to understand also, all of us need to understand that we have to work with Africa. Africa is the 4th largest world economy. And I know all of you, all of us love cell phone. They say helium is a mine that makes cell phone. They say 80% of helium are from Congo.
Yeah.
The cocoa from Congo. So we need Africa. So now, Mr. I think that we need to make a call to make that Ebola a conversation, a kitchen table conversation, so we can talk about it. Call your congressman, call your health department, and to see how we can get that under control.
Well, coming November, I will have a special hour, and I will announce it before that happens, with some experts from CDC and here in New Hampshire.
And another thing on the product for cell phones, another thing that they were just talking about on the news recently, that the price may go up because of this outbreak in Africa, is chocolate.
And diamonds.
Because 90% of our chocolate, the cocoa beans, come from Africa.
Yeah, if they
90% of our chocolate.
If everybody die over there, we cannot have anything here. So we are connected.
It's a global universe.
Yeah.
And coffee. A lot of coffee beans come from Africa in different places because they have the climate to grow them.
Yeah.
I mean, I'm
Although
sorry,
South America takes
I
care of a
can't
lot
go
of
a
that.
day without a cup of coffee. I don't know about anybody else, but I need my coffee.
You get your coffee from South America.
Yeah,
Colombia.
there is coffee also coming from Africa because it's one place.
Oh, yeah, I
and
know, I
again,
do
go and tell your people. We are really concerned with what's going on out there, and we are working on every day to make that Ebola outbreak an everyday kitchen table conversation, as all of us understand that how big is our interdependence. Africa need America, Africa need the world need America, vice versa.
We need to work together.
We cannot say it enough. We have to work together. Pastor, are you still there?
Yeah, I'm
Yeah, tell Canadian people they need make sure that you make a phone call about raising money. We need money. Yeah, to a Red Cross, because we don't know how as again 16 countries with no borders and with poor health structure. You mentioned there's not too many hospitals, not too many trained health workers. No. So help is needed.
Now, and for those of you that are watching right now, if you do have the inclination to donate to the Red Cross, call 1-800-RED-CROSS or go to redcross.gov, and they will accept your donations either way by credit or debit. And if you don't have credit or debit and you want to do a cash donation, look for your local blood donation center. They'll take the donations.
And you can also specify what you want the money to go to.
Yes, you can.
All right, thank you very much. I don't know if you have anything you want to add. Have 30 seconds.
I just want to tell you, thank you for having me. It's a disaster over there. There's so many kids without parents. There's so many family are gone. It's like a war over there right now. So help is needed.
Thank you very much. From West Africa